All right, so you've been listening to Governor Mike DeWine addressing the state after the Johnson & Johnson vaccine was pulled because of reports of blood clots. But doctors have been adamant that these events have been, quote, extremely rare.
Only 6 cases in women 18 to 48 of the 6.8 million doses of Johnson & Johnson that have been administered. It is a slight pause. He believes days or weeks rather than weeks to months. You can store the 7,000 that you have in Ohio right now until May or June. They will continue to do that, and many sites will move to either Pfizer or Moderna.
And it's interesting that they pointed out that the number of people here in Columbus, 8,000 people roughly here in Columbus received that Johnson & Johnson vaccine, about 265,000 statewide. If you have questions, if you have concerns, a lot of the doctors crisscrossing the state talking about some of the symptoms that just may have popped up. If you got it last week, then you need to be on the lookout for some things like this. 2 to 3 weeks after receiving that shot in the arm, they're talking severe symptoms, headaches so severe. One doctor said that it affects your vision, a lot of pain, a lot of swelling. But again, this is extremely rare, they say, happening one person per 1 million that received this J&J shot across the country.
Much more to come as we begin First at 4.
Recalling that more than 6.8 million doses of the Johnson & Johnson vaccine have been administered in the United States. These are truly rare events.
Out of an abundance of caution, that's why the governor is holding this news conference today, along with the Ohio Department of Health, advising all vaccine providers to temporarily pause the use of the Johnson & Johnson vaccine after reports of blood clots. Thank you, everybody, for joining us here First at 4. I'm Darlene Hill.
And I'm Brad Johansson. It is a story making headlines across the nation, and we are bringing you team coverage here. How it's being handled in your backyard. Alan Henry has been in contact with local health experts on how safe they say the vaccine is.
But first, NBC4's Adrienne Robbins joins us now from the State House, where she is there while the governor is speaking. And Adrienne, what is the message to residents here in Ohio from the governor today?
Darlene, the message really hasn't changed. Governor DeWine continues to tell Ohioans to get vaccinated. He said the best vaccine has always been the one that is out there. And right now in Ohio, because of this pause, that's Pfizer and Moderna. Now, the White House has told Governor Mike DeWine that this pause will most likely last days to weeks, not weeks to months. Providers are being instructed to store the vaccines and try to switch to other brands as soon as possible. He says the pause is so medical professionals can investigate these very rare cases of blood clots.
And the fact that the CDC and the FDA have raised concerns and pushed the pause button on the basis of these 6 cases should give Ohioans great confidence in not only the priority that is being placed on vaccine safety, but also the reliability and transparency of the CDC's and FDA's safety monitoring system.
And around 264,000 Ohioans did get the Johnson & Johnson vaccine. That includes Ohio's Lieutenant Governor John Husted, and today he said that he still has trust in that vaccine and would recommend it to family and friends. Local for you at the State House, I'm Adrienne Robbins, NBC4.
Adrienne, thanks so much. This news coming after doctors have spent the last 4 to 5 months stressing the safety of coronavirus vaccines. NBC4's Alan Henry continuing our team coverage tonight. So, do doctors believe that you have spoken to, Alan, that the vaccines are still safe?
Well, Brad, simply put, it's complicated. With today's news, doctors tell me there really is no easy way to answer that question, but they do tell me the important thing to remember in all of this conversation is the context. Now, the Johnson & Johnson vaccine was only approved 6 weeks ago and has already been distributed to nearly 7 million people. Now, of those 7 million people, only 6 of these cases have been found, all of them in younger women. But Dr. DeScaldo at Ohio Health says those are only the cases that we know of. There could be more out there, but even then, the side effect is still extremely rare. In fact, at these numbers, you have a better chance of getting struck by lightning. And Dr. DeScaldo says in nearly every case, the person with the J&J vaccine is safer with it than they are without it.
It all comes down to having understanding of the risk versus benefits of getting this vaccine. And we know that COVID-19 kills people, and senior citizens, the elderly, are at much, much higher risk of dying from COVID-19 than from having a very rare adverse reaction like one of these blood clots.
And coming up at 5, you'll hear from Dr. Gustato on the effect this news could have on the vaccine rollout, plus what you need to know if you recently got your shot. Local for you in Columbus, Alan Henry, NBC4.
So if you had recently had your shot, Johnson & Johnson vaccine scheduled for the near future. Our web team has now compiled a list of how local clinics are handling this change. To read the plan for your location, all you have to do is head to NBC4i.com. So we take a look at the latest numbers from the Ohio Department of Health today. More than 2,300 new cases reported today, 167 more hospitalizations, 90 more deaths have been reported since Friday. State's death toll now approaching 19,000. And as of today, more than 35% of the state's population has at least started the vaccination process.